non-operative treatment is an essential part of managing spinal problems, and we at the Virginia Spine Institute are proud to have 90% of our patients get better with proper non-operative care. And so what is proper non-operative care? Non-operative care must include stopping the inflammation, improving somebody's function, educating them as a way to prevent problems down the road, and then ultimately getting them back to a full functional lifestyle. And so how do we do that? Number one, we stop whatever activity is bothering somebody. So if we're dealing with an athlete and it's swinging a baseball bat hurts, we stop that. If it's a nurse working at a hospital picking up patients, we have them stop picking up the patients. We need to stop whatever activity is causing the pain. We try to keep them as active as possible because activity is good. Staying mobile, staying active is important. Bed rest actually hinders the ability of people to get better. Going to bed rest for back pain, which was an old recommendation made by doctors all the time, is absolutely wrong. And people that go to bed rest often do not get moving as fast or as well as people who don't go to bed rest. That's not to say sometimes bed rest may not be appropriate depending on how severely impaired somebody is. So what do? We have them stop whatever activity is causing the pain. We have them initially get on an anti-inflammatory, which is like Motrin or aspirin, to decrease the inflammation. If we need to, we'll actually use steroids, oral cortisone, to see if we can help decrease the inflammation, and that's the big brother of the naproxen and the other anti-inflammatories. So we use one or of those if the patient can tolerate it to decrease that, and we immediately get them into an aggressive rehabilitation program or therapy program. What this means is that they are in a program where they are actively strengthening the muscles, and we start with the core muscles or inner muscles that separate and protect each neuromotion segment, and then work on the global muscles such as the entire abdominal muscles, the back muscles. We work on their hip muscles. We have to look at their gait. We have to look at how all the joints are moving, and we have to restore all that function. Now, if necessary, we'll add in pain medicine if we need to, muscle relaxants, other medicines as we need, and if that doesn't work, we may add in focal injections to go to an area. If we know that there's a specific joint that's inflamed and restricted and not getting better, then with very precise precision using x-ray guidance, we'll put some medicine right there to help calm that down and allow us to restore back that function. But it's a very dynamic process. It isn't just you go work with a therapist, get some hot packs, cold packs, ultrasound. That's not appropriate. That they have to go in, they have to learn very focal exercise programs with stabilization as well as mobilization, stretching of their muscles, stretching of the joints and ligaments, strengthen everything, get aerobic conditioning in. The overall aerobic conditioning is important because it gives us endorphin release, it gives us overall warmth of muscles, strengthened muscles, helps us make progress forward. So that whole process, combined with the counseling program of education as to what to do to avoid future problems and how to work and function properly in your environment, and that would be ergonomics. How do you sit? How do you stand? How do you get out of bed? How do you walk? Believe it or not, we have to teach people how to do that all over. But then also dovetailing with that, how's your workstation at work or at home? Are you set up properly at a desk? If you're using a computer and a mouse, is everything structured in a way to protect your neck, your arms, your back, and how you function? And are you doing jobs that are appropriate? If you're not very strong and you're deconditioned and you're overweight, are you out doing a heavy labor job where you're lifting 100 pounds at a time and you're not equipped for it? So it's important as we take a look at a variety of people in the workforce, are they built and shaped and conditioned to do the activities that they need to do?